Why is CF newborn screening information often unclear? Cystic fibrosis newborn screening information can be confusing for several reasons related to how screening is conducted, genetic differences, and varying practices across different areas. First, newborn screening programs for cystic fibrosis use different algorithms and genetic panels. This means that depending on where you live, the tests may look for different genetic variants. Some programs focus on the most common variant of the cystic fibrosis transmembrane conductance regulator gene, known as F508del, while others might use a limited set of variants. This can lead to missed cases, especially in infants who carry rare mutations. As a result, families may receive inconsistent information about what their screening results mean. Next, the sensitivity and specificity of screening tests can vary. Most screening tests measure a protein called immunoreactive trypsinogen, which is often elevated in newborns with cystic fibrosis. However, the cutoff values used to determine if a test is positive can differ. Some programs use a fixed cutoff, while others adjust it based on population data. This variability can lead to false positives or false negatives, making it harder for families and healthcare providers to interpret the results accurately. Another important factor is genetic diversity. Certain cystic fibrosis-causing variants are more common in specific racial and ethnic groups. If a screening panel does not include these variants, it can result in false negative results, particularly in infants from minority populations. This can delay diagnosis and treatment, adding to the confusion surrounding screening outcomes. The follow-up testing process is also complex. After an initial positive screening result, further tests like cystic fibrosis transmembrane conductance regulator, gene sequencing, or sweat chloride testing are necessary to confirm a diagnosis. This multi-step process can be overwhelming for families, especially with the involvement of different healthcare providers. The way results are communicated can vary, leading to further uncertainty. Historically, there has not been a standardized set of national guidelines for cystic fibrosis newborn screening. Although universal screening has been in place in the United States since 2010, comprehensive guidelines to standardize practices have only recently been developed. Before these guidelines, inconsistent practices contributed to the unclear information provided to families and healthcare providers. In summary, the unclear nature of cystic fibrosis newborn screening information arises from differences in genetic testing panels, variable test cutoffs, genetic diversity, complexities in follow-up procedures, and historically inconsistent screening standards. Ongoing efforts to improve screening guidelines and expand variant coverage aim to provide clearer and more equitable information to families and clinicians. Always consult with healthcare professionals for personalized advice and information regarding newborn screening and cystic fibrosis.